This is Angela Grayson from the Loving Life Fitness Podcast to help others in their fitness journey. All possible.
It's time to wake up. Here we go.
Hi, everyone. This is Angela Grayson from the Loving Life Fitness Podcast, where we talk to professionals and everyday people about their life and health and fitness to be an inspiration to live your best life. And today we have with us on the show Brian Jones, who is from Hawaii and a physical therapist. I'm so excited about talking to him today. Hi, Brian. How are you?
Good. Hello. Good morning, Angela. Thanks for having me on the show today.
Yeah, I wish I was in Hawaii recording. That would be so much fun.
Yeah, it's about 75 and sunny, so that's our winter here.
Nice. Actually, our temperature today is probably similar to yours, 75 and sunny.
Yeah. It's funny to see people walking around with jackets on. Once it tips below 80 here, people get their winter clothes.
Well, we have to use those winter clothes sometimes. So, yeah, get them out of the closet, freshen them up a little bit, right?
Right.
So, Brian, I'd like to talk to you about what you do to try to help inspire others. What got you into the physical therapy field?
That's a great question. So I've been an athlete my entire life, and playing all different sports, you get injuries, ankle sprains, strains, what have you. And I was always curious from an early age how the body recovers, and essentially how you rehabilitate to get back in the game. And later in life, that had translated to a serious car accident. I got rear-ended, and I needed several surgeries on my neck, my back, my shoulder. And the only thing that saved me, other than the ortho surgeons, was the physical therapist. And creating a strong bond with my PTs solidified my game plan in life. I was doing it every day, and it had turned into a lifestyle. And then that's when I realized I'm going to do this for a career.
Awesome. How old were you when you had that accident?
18. So I was just at a stoplight and got rear-ended. So pretty fast, drunk driver. Thankfully, I'm still here. But they did need to put some screws in my spine and in my neck. And so they call that a fusion, cervical and lumbar fusion. And then I had some screws put in my shoulder to help the bones heal.
Okay.
Yeah.
So that turning point in your life kicked you off to a great career to where you can help others. Yeah.
I was headed to the military, and it's essentially divine intervention because the guy I signed up with, unfortunately, is no longer here. But I often think about if he got killed overseas. And I think about that all the time. If that accident never happened, would I be here? So I feel grateful, even though through trauma and tragedy, you got to look at the silver lining, right?
Absolutely. No doubt about that.
Yeah.
Can you tell us about 3 people in your life, inspirations, mentors that help inspire you to be what you are today?
Sure. Yeah. The first one that comes to mind is a professor I had when I was in graduate school in Florida. That man has more passion and knowledge about helping others that it was contagious. So not just as a professor, but in the community, he would volunteer and get involved. And from that one experience alone, I could see that the more you give, the more you get. And that has translated into my current situation. Sure, it's nice to go to work and help patients, but what you really feel good about is getting out there in the community and helping. So his name's Eric Seamus, Dr. Eric Seamus, and he has wrote several books about physical therapy. And it led me to realize the importance of volunteer work from that one man alone. I'll elaborate on that. I currently volunteer for an organization called Access Surf, where we get handicapped children out in the water to surf. So there's a whole team effort, PTs, OTs, nurses, doctors, we all get together and we carry the disabled individuals in the water. And there's adaptive equipment so we can teach them how to surf. And then I also work for an organization that helps disabled veterans scuba dive. So I'm a scuba instructor too. It's fun. That's where I have the most fun. Yeah, sorry, detracted from the original question. But yeah, just from one interaction with a mentor or a figure that shows you the importance of living, I've carried that with me through my whole physical therapy career.
Adaptive sports. I
Yeah.
did do another podcast in the beginning when I first started with somebody here who works for a physical therapist called Brooks Rehab. And they have a similar program, and they work through another organization called Oceans of Hope. I don't know if you've ever
Okay.
heard of them.
Yeah, I actually have. Yeah, there's several organizations out there, but it's all in the same effort.
I know somebody who has muscular sclerosis, and she is involved in that program. She has been surfing with them. She has been water skiing. She has been kayaking, which
Yeah.
recently she sure hurt her shoulder doing that. She's trying to recuperate from a tear in the shoulder.
Yeah, and that's why we need physical therapists, right?
Yeah, absolutely. Yeah, us personal trainers can't do it all. We don't have quite the extensive education that you have.
Yeah. Oh no, it's everyone has their specialty, and it's an interesting dynamic. I had started off wanting to be involved with personal training, and life just kept pushing me down the road of PT.
Mhm.
So yeah, I've been fortunate enough to work in many different environments and see what's out there, different specialties, and how we all help each other. I think that's the
Yeah.
most important message. Those in the
Absolutely.
those in the medical field or wellness and exercise, it all accumulates into the important psychosocial thing that we don't often think about.
hmm
So exercise medicine.
The first time I talked to you, you told me that you were going to a marathon that day,
Oh yeah.
and
The
you were going to
Honolulu
be
Marathon.
volunteering and
Sure.
taping and helping the people who were in that marathon. And I was impressed right there from the start that you were volunteering your time to go and help
Oh
others out there.
yeah. I just feel like it's part of your job to help out. And it's simple things, sprains, strains, someone twists an ankle, and they've trained maybe 6 months, a year for this one day. And I gotta commend people to push through. And I'll take a quick look. I was in the medical tent, and we take a look at a couple injuries. There's a physician next to me, and what do you think? I'm like, I can tape it up, and then okay, let's go. So I worked for the World Surf League for about 5 years. That's pro surfing. My clinic was in Haleiwa on the North Shore of Oahu, and yeah, I would do all the surf tournaments every weekend. So same thing. Surfers would get injured, neck, have a wipeout, whatever, and we'd have to clear them to get back in the water just to make sure everything was okay. So that's the athletic trainer in me. I went to undergrad for that athletic training.
hmm
So,
Excellent.
yeah,
Let's do a little talk about KT taping.
sure.
There's still so many people who have never heard of KT tape,
Sure.
and I had that used on my shoulder many years ago when I used to work at the post office, and I had an injury with my shoulder, and I was amazed. I'm like, okay, what's this tape on my shoulder gonna
Yeah,
do? And I was just amazed at how it helped heal. And
Sure.
can you talk about it a little bit? Let
Yeah,
listeners
absolutely.
know more.
Yeah, so kinesio tape was invented by a very, very interesting Japanese man about 25 years ago. It's been around for a while. But essentially, you have to think of muscles. There's origins and insertions. So where the muscle starts and where it inserts, and how muscles contract. So concentric motion. Typically, with injuries, they're overuse, meaning you constantly do the same motion over and over and over, and that leads to tendonitis. So kinesio tape is there to kind of help facilitate motion of injured muscle tissue, ligaments, or tendons. So the way we apply it is just as important as how much pressure we put on it. So if you have, say, bicep tendonitis, you're going to put the tape farther down the arm or distal and then tape it proximal, so up the arm. And that actually will help turn the muscle off, essentially giving your body a break. So it's not just used for muscles too. It's also used for ligaments. That's what holds our bones together. So the ligaments, everyone's heard of probably the ACL, or I'm sure that's the most common one we hear about in sports, getting injured. But there's also an MCL, the medial collateral ligament on the knee. And if we put the tape on and like a different pattern, like an X pattern, that'll help stabilize the ligament. And often it takes the pain right away. So if you watch any baseball, basketball, football, professional sports of any kind, you'll see the tape on there, and it could be black, blue, pink, purple, neon green. And that doesn't really matter. But It's an effective way to get athletes back in the game and moving and give your sore muscles a little break.
So do you recommend somebody who's just going to the gym and they're having some kind of soreness in their shoulder or their elbow or their knee to use the tape?
Yeah, but it's also important you have to understand how to apply it.
Mm-hmm.
If you put it in on the wrong direction, meaning, again, let's say bicep tendonitis to a stranger, your bicep in the gym lifted too much. If you put it on from proximal or from the top of your shoulder to the elbow, it's going to actually make it worse. So it's going to activate the muscle. We want to inhibit it. So yeah, but this tape is effective for all sorts of instabilities too. So most common one I see in the gym is wrist instability, especially with like CrossFitters who are doing burpees and putting a lot of impact on their wrists. As we get older, sometimes those carpal bones, the little tiny marbles on our wrists, get a little loose. And the most effective way to help stabilize it is kinesio tape, because it bends and stretches and moves, and it's not 100% restrictive, so you can move with the tape. I really like it. I'm a big advocate.
Yeah. And of course, if you really don't know what's going on inside of there, it's a good idea to go ahead and see somebody, a professional, so that you can
Sure.
find out what's going on. So you're making sure that you do apply it correctly.
Yeah, there's some hurdles. With physical therapy, there's something called direct access that our organization has been fighting for years. And essentially, you don't need a referral to go to a PT. Like in Hawaii, where there's something called direct access. You sprain an ankle and you're like, I don't want to set up my appointment with my PCP. And then get a referral to an orthopedic specialist. I mean, we're looking 6-8 weeks, right? So fortunately, there's that law. It's a variable upon which state you're in. But I feel like our field's heading in the right direction to try to help people out as soon as they need it, because atrophy, right?
Mm-hmm.
It takes place in 3 days. So essentially, I think of my geriatric population, they have a fall, they get injured, they're not moving, they just sit around. And then with 3 days, atrophy happens. So we often like to tell patients, the sooner you get in, the better we can help you.
Mm-hmm. Absolutely. And if you do something to one part of your body, don't stop using the other parts, right?
Well, compensation, that's a big thing too. So you sprain your left ankle, all you're going to see is overuse of the right hip and right lower back. And that leads to compensatory motor strategies. So, because people always think, oh, well, I hurt my arm, I'll just let it rest. And it's like, yeah, but you should also know what specifically is injured so we can tell you what to avoid as well. Yeah, most people think PT's, all exercise or what have you. But in reality, we mostly do a lot of education about what not to do. So not re-injuring the thing that you may have hurt, or if you've had a serious medical procedure with hardware, right? So orthopedic surgery, don't do this because it might aggravate that. So, yeah. Hope that makes sense.
Yeah. So I hear a lot of people believe in physical therapy. Others are like, oh, physical therapy doesn't do anything for me.
Yeah, right. Oh, that's every day. And just like dentists, I always like to use the analogy, you've been to a good dentist and you've probably been to a bad dentist, right? I have.
Yeah.
So there are individuals out there with specializations. So for example, mine's in orthopedics. So bones, muscles, joints, tendons. I wouldn't be very good at treating a pediatric patient. I mean, I try my best, but I'd rather them go see a pediatric specialist, or there's geriatric specialists, someone who specifically handles the aging population. And now with physical therapy, you're going to come across several, for lack of a better word, quantity over quality. They just try to run the numbers up to get paid, right? I mean, at the end of the day, most clinics are businesses. And unfortunately, I've seen a current trend here in Hawaii where some major hospitals just look at numbers. It's not really about patient advocacy. It's more or less about just getting people in and out. Ride the bike, do that stretch. Okay, get out of here. And it can be farther from what people need. They need a specialized program, but we'll know right away when a patient comes in and says, I'm not better, nothing's working. Okay, show me your range of motion that we've been working on. Show me the exercise you've been doing that helps facilitate external rotation. We talked about this, and we'll give them texts and exercise And you wouldn't believe how often we see people have no clue. They stare at you blankly. Like, come on, man, you've been here for 4 weeks. You got to know what to do. I can't do it for you. And yeah, and so there's some miscommunication sometimes. Again, psychosocial issues, pain avoidance, fear avoidance behaviors, right? When we're hurt, we don't want to move. And that couldn't be further from the last thing you want to do. You want to move for multiple reasons. But a lot of times you'll hear PT didn't work, and it's partially because people don't adhere or comply to the program. So I always like to think about how hard it is to get myself to the gym some days. And think about when you're hurt. Do you really want to go move? Especially with medication and comorbidities. So there's a lot of variables to consider. But in my personal experience, people who do adhere to a program and are diligent and are active in the community and have good support networks, it all matters. And you have to get them out there and believing they will be better too. So the power of the mind, I think, is important.
You have to want to get better. There's definitely ways to do that without right away going through surgery. A lot of insurance companies won't even allow surgery unless you go through the steps to get better first.
Yeah, that's a great example. 100% perfect. Say I come across this actually just happened recently. I was checking a high school athlete, her knee out, and I was doing a test and realized she's missing her ACL. And the family was there, and they're like, how long until PT fixes it? I was like, yep, well, none, because you need surgery. So we know she needed surgery, but the insurance provider, I won't mention the company, but you need 12 sessions of failed conservative intervention before they'd even give you an MRI. And insurance companies, they have their policies for a reason, but I was like, look, while you're here, let's talk about how we can work on that opposite hip that's compensating for your weak knee. So, there's other stuff we do called prehab, getting you ready for surgery. So worst case scenario often is surgery. It's scary for a lot of people, but there are a lot of things that a provider, physical therapist can do to help facilitate the recovery process. And whether that's range of motion or strengthening or flexibility, it all matters. So the better program you have going into surgery, the faster you'll recover after.
Yeah, there's the big picture. Just because one part of our body is hurting doesn't mean we don't have to work on the other parts to help it. Everything is connected. So just like you said, if it's the right side of the body that needs surgery, let's say the hip, you want to work with the left side of the body to stay strong to help support it. Maybe even losing weight, right? Losing weight before surgery. You're going in for knee surgery. You've got somebody who's overweight. Do you recommend?
Oh my gosh, that's a question we would love to talk about as physical therapists. However, there's only so much time. And I found in the past, people ask me, like, do I need to lose weight? The answer often, most times, is we all need to. I'll make a joke. I'm like, I got to work on my belly too. But the reality is you kind of don't want to distract them from the goal of what we're trying to achieve in PT. Education about their injury, what to do, what not to do, and compliance. But when we start talking about diet and nutrition, it often goes kind of off the rails and we lose focus. But if I see someone several times and they are inquisitive, sure, I can absolutely help them with a program. And yes, losing weight and improving your cardiovascular health, it all matters in regards to recovery.
Have you ever had anybody ask you about these new diabetic drugs to lose weight?
I just met with a Wegovy rep last week.
Yeah?
So, semaglutide. So part of my job is I do another job on the side marketing for a physical therapy company that sends PTs to Medicare patients' homes. So I help out with getting PTs to people's homes that can't get to the clinic. So I go meet with several physicians around Oahu Island, and I ended up at a diabetic clinic saying hi to one of the docs I knew and shared out for the pharmaceutical rep for Wegovy, also known as semaglutide, the peptide. So we talked for a good hour, and you wouldn't believe how often people bring it up to me, probably every day.
Wow.
What are your thoughts? Or before I go on my tangent, have you had people ask about semaglutide.
Yeah, absolutely. Yeah. Except I don't have the professional answers for them. I
Me
don't
neither.
know enough.
Yeah. I mean, what I've read online and from blogs and say, I do enjoy podcasts like Dr. Andrew Huberman, neuroscientist. He goes into a depth, but essentially it's a new field of medicine. And I was talking to a physiatrist friend of mine who does stem cells and PRP shots. And apparently they're asking physicians to take continuing education on it just to learn, because the way I think the insurance companies are going is they're trying to push for this drug for cardiovascular problems, diabetes, weight management, orthopedic joint issues. I mean, the reality is when we lose weight, our bodies typically improve.
Mhm.
So the pharmaceutical rep had mentioned all this data and meta-analysis studies, and I'm like, okay, great, but tell me, if people are just not eating, like let's be real here. If you stop eating, yeah, you lose weight, but you also will lose your lean muscle, what you've worked so hard for. And she was like, absolutely. So you lose fat and muscle, and there are detrimental effects to just taking the drug and not having a proper diet.
Yeah.
So as far as I know, they're looking into research about that. But, let's face it, pharmaceuticals are a big business.
Yeah.
And if they can pass that drug for all those medical conditions, I think we're going to see it more and more every day. I mean, Elon Musk is on it, right? Like, and these celebrities, I can't recall who else, but I'm sure there's some popular ones out there.
Yeah. So people do your research, right?
Yeah.
Yeah.
By no means am I a diabetic physician, but they are using it, and the qualifications to get on it, from what I understand from having a meeting with that doctor, is that they're pretty low. Meaning, if you're obese and you have comorbidities, you can be applicable to the drug. So, yeah, it's interesting.
Okay. You had mentioned your PRP, the platelet-rich plasma program, therapy, treatment, however. Yeah, you can say that. Can we talk about that? Yeah, I know you're getting into that with Dr. Dwight Lynn.
That's right.
Yeah.
I said lunch with him yesterday. We're starting a business in the future, maybe 6 months to a year. It takes time. But when I worked with the surfers, a lot of them don't want to have surgery, right? You have a tendonitis, you have a tendinopathy, you have a muscle strain, whatever it may be. And the last thing those guys want to do is go through surgery, because being active is their whole life. So I'd often send the patients to refer them to my friend, Dr. Dwight Lynn, physiatrist. He works with stem cells and platelet-rich plasma injections. That's my focus, is combining rehabilitative medicine with regenerative medicine. And we see the light on the horizon, the future of medicine. Unfortunately, people are going to different countries to get the treatment they can receive here that's potentially, I'll just say it, more safe. I've been hearing some crazy stories about injections people have been getting, and infections and losing eyesight, whatever it may be. Horrible stories. So go to a professional. But in any case, your listeners or anyone has not heard of PRP, platelet-rich plasma. It's where we take a patient's own blood and you draw out several vials, so 10 milliliters. You probably get about 40, 50 milliliters of blood, and then you spin it in a centrifuge and extract the platelets at the top layer. Then those are re-injected back into your torn tissue or tendon. And platelets are in our blood, and what they're responsible for is rebuilding new tissue, or essentially fibroblasts that make new muscle, ligament, and tendon tissue. So it's actually pretty cool. Rather than our own body sending platelets to the site of injury, let's call that 1x, just how many platelets you have in your body at any given time. The PRP injections with Dwight Lynn, he's doing 50 to 60x. So in one injection, you're getting 50 to 60 times more platelets to that site of injury. And it works. Pretty cool. So it hurts. It's not fun, because inflammation is our body's way of healing damaged tissue. So the PRP injection really inflames the localized site for 2 weeks. It kind of sucks. So the first 2 weeks after you get your shot, we're telling patients, don't do too much, no weight lifting. You can do some stretching, but essentially the platelets are rebuilding the scaffolding of your tissue. So it's pretty cool.
So you can either put up with the pain from whatever's going on in your body or get the treatment and put up with that pain and hopefully feel better.
Yeah, I mean, there was a EMT I worked with recently, and he didn't want to have surgery. So we went to 2 ortho surgeons. They said, yeah, you need surgery. And I was working with him. Full mobility, pretty good strength, but he's missing that snapping strength he needed to lift patients and it's into his ambulance. And so I referred him to a friend, and sure enough, the PRP, he had to take a couple weeks off work just to chill, but he went back to work. That's what was last he told me. He's doing fine. So it's not a 100% fix. We'll say, well, I've had it personally to my shoulder and neck, and let's say my body's at 70% effectiveness. The PRP shot got me up to like 90%. So not 100% better, but definitely improvement. So, and that matters when we're engaged in our more vigorous activities of life.
How long does it last?
Yeah, you're good. Typically, there's a routine of 2 shots. So you do them 6 weeks apart. So your first shot, and then your 2 weeks, you just kind of chill, stretch, gently move. Start going back to some gentle strength training on the area that's affected. Light resistance work, so bands and light weights, nothing advanced. No free weights, no bodybuilding. And then at 6-week mark, you would get your second injection. So, and then now the VA, TriWest, TRICARE, that's the insurance for military members. They're covering the PRP shot. So I think it's pretty cool. And hopefully other insurance providers will get around to covering it too.
Wow, that is great. And they're the only ones right now that are covering it.
Right here on Oahu, there's a couple docs, but they utilize like a 4 or 5x concentration of PRP.
Mm-hmm.
And my friend Dwight Lynn, he's doing 50, 60x. So, and now I've only had that approach. There are variabilities in that specialization as well. So it's confusing. And I know I've been dealing with it for the last like 7 years, having these conversations with my friend who does this. It's still confusing for a lot of people. So if you do have questions about PRP, you can always reach out to me directly and I'll share my information, right?
Yep.
So, yeah.
Excellent.
Yeah. And I do these little educational videos on social media to people ask me questions and I'll show them what we usually do. It's been fun.
Is that through your business or your own personal?
So yeah, it's a business profile, but it's TikTok, Instagram, Facebook. But yeah, people ask me, it could be anything from TMJ pain, or it could be a acromioclavicular ligament sprain, AC joint, and they'll send me pictures and what do you do? And I'll help them out. Obviously, it's better to go in person, of course.
Of course, yes.
But it's been fun.
So you used to do a radio show.
Yes, yeah, with Dwight Lynn, the guy I was talking about. Yeah,
how long ago was that?
Oh, so that was 2018 to 2020. And then when COVID happened, literally everything shut down. We all know what happened. But it was at the old Dole Cannery factory where they used to can all the pineapples. They turned it into business offices. It was kind of cool. And we would just take calls in the morning from people who had questions about stem cells, PRP, physical therapy. So it was cool to combine minds on that.
Mm-hmm.
Yeah. It's called The Moving Body. Yeah, well, eventually I'll probably get back into something like that. But it's still nice to reach out to people and have individuals reach out to me about concerns they're facing with surgery or injuries. And any of your listeners can always feel free to reach out to me as well.
Very nice. So Brian, with all that you do for others, how do you find the time to take care of Brian?
Well, wake up early.
Okay. Morning person. Yes.
I don't want to be, but it's funny. You had mentioned influential figures in my life earlier, right? And I've been listening to these motivational YouTube videos. They're silly, but they work. There's a guy, Jocko Willink. He's like a Navy SEAL guy. And I put him on as my alarm clock, like get out of bed, 4:30, time to go to work.
I love it.
It's bad, but he's like, stop making excuses, make your bed, go to the gym. And it's just like very simple advice, but sometimes we need to hear reinforcement.
Do you make your bed?
I do.
Awesome.
First thing you gotta do. There's several philosophers I listen to, but yeah, there's one pretty famous psychologist out there he has a whole thing about make your bed, and that sets the tone for the day. So if you fail at the minimal tasks, you're gonna fail at the big tasks. So how you do anything is how you do everything, right?
Very good. No wonder why my mother always told me, make your bed.
Yeah, it didn't hit me till I'm in my later 30s, and it didn't hit me till recently. So don't worry, um, we're we're all still learning.
Absolutely. Okay, what's your biggest failure? And what did you learn from that experience?
Oh, well, I tried to quit being a physical therapist in grad school.
Wow.
Yeah, I would consider that my biggest failure because the professor I'd mentioned earlier, he was the guy who kind of reeled me back in. And life gets hard sometimes. Family members pass away, relationships fail, or you just make second guess things. I recall going through some very difficult times in graduate school. And that's tough for anyone, whatever you're studying. School's hard. You gotta be dedicated. And I had left and I said I quit the program. And then my professor, friend, colleague now, he advocated for me and essentially begged and pleaded to let me back in. I didn't do anything bad. I just walked away.
Yeah.
And that I'll never forget him helping me to achieve the goal I set out to do. And I want to, it's not quite my biggest failure, but that's the one that sticks out to me. Quitting. I don't want to quit in life, especially on myself or others. And it's in rehabilitation or injuries, quitting, it's just not an option. Life's sometimes not fair. It can be difficult, but you have two options. You can quit or you can keep moving forward, right?
And thank goodness for that professor.
Oh, yeah. Hey, Eric. Yeah. What's up, man?
Thank goodness for his intervention and getting you back on your path again, because look at what you've done with your career.
Yeah, it's been fun. And every day you learn something new. You see things through, even if it sucks. Maybe you're writing a book. I like to paint at nighttime to relax my mind. Finish that book, finish your painting, whatever it may be. I think dedication is more important than motivation, meaning we get motivated to go to the gym, but there's days I don't want to go. There's days I don't want to read, but you have to dedicate yourself to the task that you started. And that goes for relationships and transcends all of life's little areas. Don't quit.
Very good. Very good. So you said you're a morning person and you like to usually get to the gym in the morning, or do your workouts in the morning that works for you?
Yeah.
What about nutrition? Do you stick to a program? Have you made lifestyle changes, or you just anything goes?
Yeah. So I'm not quite as meticulous as some people you may see on YouTube, the weighing your macros, right? Proteins, fats, carbohydrates. But recently in life, I would say just about a year ago now, I quit drinking alcohol, and it's socially acceptable. So I went years just thinking, oh, it's okay. But it's catabolic. It affects your diet. It's not good for you. We all know that. But I think that was the most important dietary change I made. Just less alcohol or no alcohol. It's not good. More than anything. But as far as nutrition goes, I have, are you familiar with basal metabolic rate, BMR?
Yeah. Mm-hmm.
Yes. So I utilize that formula with anyone who wants to lose weight. So BMR is just essentially how many calories you burn while you're doing nothing, watching TV. And then you factor in how many calories you burn through exercise. And that should be your standard intake of calories through the day. So I try to focus on that formula and how much calories I need just to stay consistent.
Mm-hmm.
I hope that makes sense.
Yes,
So,
it does.
yeah, counting calories is important, but I'm not as meticulous to say some bodybuilder.
Right. And what does your weekly workout program look like that keeps you healthy and strong?
Sure. So 4 days a week at the gym, and then I do yoga like on Wednesdays. And then on the weekends, I'm hiking or surfing. And then as a scuba instructor, if they need me to teach a couple classes or something, I'll get out there and, you're exercising, carrying tanks and swimming in the water. So something fun. You can't you can't go to the gym every day. It's just boring. Before work, great. You're done. You're good. It's accomplished for the day. But I think everyone needs to make time for that hour. Just an hour. I'm not saying you have to go to a gym, but just a walk around the neighborhood before you get busy with your day-to-day life or start looking at your phone. Surfing.
Variety is so important. You've got to keep it interesting, do the things you like to do, get out there and enjoy your life, right? Keep moving.
Yeah, I even went for a bike ride 2 days ago, just at sunset around the ocean, and that's when I needed that day. So
nice.
I feel like people get too stuck in their routines, and it's like it's okay to change it up a little, try something new.
Mm-hmm. What does surfing do for your body?
It's more for the mind, because when I get out there and you're just sitting on the waves, looking at the ocean and the clouds, just kind of connecting with nature. So I always bring like a little face mask, a little goggles, to see if I can see some turtles or marine life or anything down there.
Okay.
Yeah. So it's more for just connecting with nature. I'll be honest, I'm not a very good surfer. I'm from Cleveland, Ohio. I didn't learn to surf till I was 26. Yeah, and there's kids out here who have been surfing circles around me, and they're 10 years old, and you're like, okay, you can't focus on them. Just be you. It's okay.
Balancing on a surfboard. I mean, I know I've been out there paddleboarding, and paddleboarding, your legs are mostly in one place. You can move them around a little bit. But wow, your legs get tired from standing on that paddleboard.
Yeah, so for my neck injury, I sometimes can't surf that long. So we do sup surf, right? Stand-up paddle surf. So I'll just paddle out and catch some waves on that thing. But yeah, it's fatiguing. And especially on the ocean, there's waves. So you have to really lean in or lean back and paddle through. And
yeah,
it's a lot of fun. It feels like that's where I belong. So
nice.
I enjoy it. Yeah.
So you say it's just for your mind, but I think you're doing something for your body there too.
Yeah, and then you meet people on the water too. You're like, hey, what's up? Make new friends. Everyone's out there to have a good time. So there's usually never bad energy, for lack of a better word.
We used to have a boat, and all the boaters you would meet out there, similar story. It's just everybody's out there to have a good time. It's just a beautiful day. Beautiful.
Yeah.
Yeah.
Look at the clouds, man. What's there to worry about?
Being out on the water for a day is like being on vacation for a weekend.
Yeah, absolutely. Yeah, I did some scuba diving in different countries, and we'd go on boats for like a week at a time. It's pretty cool, but I don't think I could do that for work. I miss land too much.
Yeah. So you're from Cleveland, Ohio. I heard you mention that you went to school in Florida. That's where I am. Now you're in Hawaii. Wow, what a track record there. Here, there, and there.
I got a few more places, but yeah, as a physical therapist, they're in demand. So anywhere you go, you can pretty much guarantee you'll find a job somewhere. So
yeah,
very fortunate in that aspect. Just like traveling nurses, there's lots of programs for traveling physical therapists too, and they do contract work. I've been fortunate enough to live in several states and check it out, and went to Texas, Arizona, Nevada, and I was like, the desert is not for me. It's 3 months at a time, and this was when I was just starting out. And then made it to California and then Hawaii, and I just never looked back.
Nice.
So, yeah, it's not bad here. Everyone will complain about something, but we just call it paradise tax. I think a lot of people in society, this is a speculation, so I think a lot of mental health issues have come from the inability to go outside, go for a walk in the forest, or, just sit by the beach. I only can speak for myself on that one, but when you can't do something, you realize how important that one thing is.
Yeah, I live like 10 minutes from the coast here, the East Coast of Florida, and I just love going for walks on the beach or even driving down A1A and seeing the water.
I know A1A. Yep.
Yeah, going to eat and having the view of the ocean, or this time of year, maybe catch a whale jumping out there,
They're here. Yeah, the humpbacks are here right now, too.
Are they? Yeah.
But yeah, probably later today, I'll go down to the Waikiki and just try to paddle out. But same thing, just driving along the coast, you're just like, it feels like your blood pressure drops just a little bit. You're like, okay, all right, I'm all right.
You're in paradise.
Yeah.
How lucky are you?
I'm okay. I'm doing all right. Yeah.
So there's a question for you. What's the best thing that people can do for themselves for optimal health?
Create a program that works for you. Don't focus too much on the big goals because that'll just frustrate you. When I was working with clients or patients who, I need to lose 80 pounds, I need to run so many miles, I need to lift this much weight. And it's like, okay, it's good that you think that way, but let's create some daily, weekly, monthly goals and save those big goals for the end of the year. Now it's January, so it's okay to write your big goals out, but we lose sight of the small goals in between. Now, whether that's not adding sugar to your coffee, right? Or small little calories add up over a year. I was having this conversation with a friend the other day about Starbucks, those holiday drinks,
Mm-hmm.
and she had I Googled it. She's like, don't look. I'm like, I'm looking. Like 71 grams of sugar in like the one drink. And I'm like, you do know that any more than 45, you increase your risk of heart disease, diabetes, stroke. She's like, yeah, I don't want to hear it. But, we're having a good time. But I mean, those small goals, switching your favorite beverage to something with less calories, it adds up at the end of the year. So I would say the most important thing for fitness and well-being is just focus on your daily goals.
Very good. Chipping
Make your
away a
bed.
little at a time.
Make your bed and then drink your water and do what you got to do. But it starts with the small daily routines, and then that translates into noticeable differences. Absolutely. I've had friends who, I hate to say disappear, but, put down the social media, start reading, improving your quality of life. And it's amazing how much faster you improve when you're just focusing on well-being.
Love it. Very good answer. Okay, listeners, take that and stick it in your back pocket and pull it out. What is one piece of advice you'd give to someone starting out in your career?
I would say don't get married to one idea of what you're going to focus on. People go into this physical therapy field because they, more times than not, they've had a injury and they're like, okay, well, I had knee surgery. I'm going to be an orthopedic physical therapist. But keep your mind open. Try new things. Like, for example, I didn't think I'd like wound care, and I was right. I didn't like it. It was not for me. But then I worked with pediatrics, and somehow the kids just made me feel good. So you don't know. You think, oh, these kids are going to be tough to deal with, but they were the most innocent, happy, grateful people you'd ever met. It's awesome. So, I've kind of navigated the waters back to orthopedics, how I got hurt. But I would just say keep an open mind. Never in my life would I think I'd be from Cleveland, Ohio. I'm a scuba instructor for disabled veterans in Hawaii. It's weird. Paraplegics can't use your legs. I'm like, I got you, man. Grab their scissors and take them down. Just keep breathing. We go over all this stuff before we get in the water, but you never know where life's going to take you and what experiences will change your life. So keep an open mind would be the proper answer.
Very good. Yeah, I used to work with a couple of personal trainers who one was going to school for physical therapy, and it was hard. It wasn't easy.
Well, that's I didn't add that to the story, but I was a wedding DJ in college.
Yeah.
And I was like, ladies and gentlemen, focus your attention to the main doors. The whole thing.
Great.
And you make good money doing that. I was
Uh-huh.
in, Florida, and I was making, X amount a weekend. And I was like, I don't need to be a physical therapist. I'll just be a DJ the rest of my life. And it's really the reason I was thinking about just dropping out of school. I was like, I don't want to study. I'm just going to go play music.
Mhm.
And oh my gosh, I'm so grateful I didn't keep doing that because that lifestyle is not sustainable.
Yes. Yeah. So the personal trainer, he stayed in school. He did it and became a
Yeah.
physical therapist. And then there was another one that started working there, and she was like, I want to go to school, but I don't know if I can handle it. And I kept on encouraging her to do it. Kids, they're so much younger than me, working at a gym. It's like, how long can you sustain that? Your people, your clients, they come, they go. You have cancellations, you don't get paid. Why not do something more, and get more education about the body, especially if you love working with the body and learning about the body and how it works. Why not do more? Yeah.
Yeah. I mean, even some physicians don't really know all we do, which is okay. Because every now and again, I find myself elaborating on spinal cord injuries or stroke, CVAs, neurological. You had mentioned multiple sclerosis earlier, MS, and there are tests that we do to help figure out if someone has it. They're weird tests, but I've always found that the more you learn, the less you know. And so if I recall back to, we went through our teenage years, we know it all, right?
Of course.
I sure did. I knew everything. And with each new book you read, you're like, I didn't know that. Oh my gosh, what don't I know? And I always tell young students, I was a clinical instructor for like 6 years, so taking out PT students. And I'd always tell them, like, you don't know something, go look it up and teach me because I don't know. And the more you know, the less you understand, or vice versa. I can't say that right. Sorry. But essentially, you need to keep the education process going strong. Right?
Yes, keep it going strong and using it, because the more you use it, the more familiar you become with it. It's just like you go to school, you learn all this stuff, but until you start putting it to use on every day and working with people and their different issues, different personalities, different things going on in their lives, that's when you really start learning, right?
You could read in a book all day, but once you see that condition on someone, like this one kid always comes to mind. I was in Miami and he got a gunshot wound in the neck and half of his spinal cord got removed, right, from the bullet. And they call that Brown-Sequard syndrome. So basically, his half of his body worked, kind of. And then his other side was like contracted. So what they call that decorticate spinal cord injury. But it's so weird because half of his body worked, the other half, nothing, right? So you can read this in books all day, and then you see it on one patient, you're like, oh, okay, I get it. So my advice, and with school, you go work with people. So a professor of mine had said the rule of 10,000. You work with 10,000 thumbs, you'll be a thumb expert. You work with 10,000 ankles, you're an ankle expert. And until you work with that number of people, don't even think yourself an expert. You're not even there yet. So it takes time.
Yes.
It takes time, especially with people where we're all built just a little different.
And some people adhere to the program, some people don't. So different personalities.
If we know someone's, why am I not losing weight? Well, tell me what you've been doing. You'll know right away. Like, I don't know if you've had this happen to you, but have you ever caught any of your clients in the parking lot eating like what they shouldn't be eating? I could think of several people I know personally. They're eating a McDonald's cheeseburger on their way in. I'm like, what are you doing?
But I'm hungry.
It was cheap. I'm hungry. And I'm like, dude, you're going to go on that treadmill for 2 hours to burn your 600 calories, as you say, with those two cheeseburgers or whatever. It's just, you got to think logically about it is all. Sure, I love junk food as much as the next. I always like the treadmill analogy, right? All right, have your large frappuccino with extra whipped cream, but that's 800 calories, man. You got to be on the treadmill for 3 hours for that one. Sorry, Starbucks. I'm not picking on you. Have you ever caught someone cheating on their way in?
No, I haven't.
Okay.
No.
Okay, good.
Hopefully they haven't caught me.
Right. Someone did catch me at the grocery store not too long ago, and I had like frozen pizzas and some candy, and I'm like, look at me. It's the holidays. What do you want?
Yeah.
Yeah, they're like, oh, healthy diet. I'm like, don't tell you. It's okay.
Okay, so my next question is, do you recommend any books for our listeners?
I was fortunate enough to go to Japan last year for snowboarding. I love Japanese culture. There's a lot of Japanese population here in Hawaii, and there's a saying over there, ikigai. That's a word that defines life purpose. So there's a book that I picked up over there, Ikigai, the Japanese secret to a long and happy life. And essentially it's about defining your purpose when you wake up, get out of bed. If I could just put it down to one sentence. If you don't have a reason to get out of bed and pursue a goal for that day, it's more often than not that you're not very happy or struggle with maybe depression. Again, speaking for myself here, I did. When I didn't have a focus or goal in life, you just kind of feel out of it. You're like, I don't know what I'm doing. Then I read this book, Ikigai. You can find it on Amazon, but basically it goes through a series of steps to try to help you define what makes you happy and what your purpose is in getting out of bed each morning. Above all self-help books, I think that we all need to define and find our Ikigai. So something that motivates you and makes you want to work hard or learn, whatever it may be. It might be acrylic painting or hiking mountains. Whatever it is, you go do it. And if it makes you happy, that's good.
How do you spell Iki?
Yeah, Ikigai. Basically, it's what gives your sense of purpose or reason for living. Because there's so many. I mean, I've read philosophy books from Thailand and China and all over the world, whether it's Christianity or religious texts or I'm curious. And the one that stuck with me the most was the Japanese book I just mentioned, Defining Your Life's Purpose. And it's good. Once you can figure that out, maybe mine's physical therapy, right? I was out at a friend's, he's in a band. So I was at a show last night, making friends, saying hello to people. And this girl, her elbow was, you could see it was totally, essentially deformed. And they're like, oh, Brian's a PT. And then she's like, take a look. I don't know. Help me. So I'm playing around with it. And like, yeah, we can help this. She's like, really? I'm like, yeah, of course. And it was just an old injury she never took care of. But I feel like my life's purpose is to help people improve from their physical injuries. And it just seems to follow me around everywhere. Like I go to the grocery store and there's, hey man, like someone knows me or whatever it may be. And there you go.
Yes, absolutely. That's awesome. You found your life's purpose and you're following your dream. That's great. All right. So my last question to you, Brian, is I'd like for you to set a goal for our listeners and maybe tell them a little bit about how to get there.
Well, your podcast, we're focusing on health and wellness. And my goal would be to try to establish one thing, just one, that you can do each day to help your physical and spiritual and improve your quality of life for that day. Now, whether that's taking out the extra sugar in your coffee, whether that's going for a walk in nature, maybe you're feeling like your muscles are tight, or maybe you feel weak. Trying to find that one thing that's going to help you improve for that day is the small goal I was talking about. If you have pain in your hamstrings, try stretching them that day. If you feel like you don't want to get out of bed and lay in bed all day and hide under the covers, go for a walk. It's like finding comfort in the discomfort, if that makes any sense. So there's a saying, if you're not uncomfortable, you're not growing. And that really sticks with me. So redefining it, do something each day that makes you uncomfortable. What I'm focusing on in life right now is to be someone you've never been. You have to do something you've never done. And that the old saying is, if nothing changes, nothing changes. Right. So if you need to find something uncomfortable to do each day, we'll define it like that. Yeah, I challenge your listeners to try to find something that makes them a little scared, a little uncomfortable, a little out of the comfort zone. And whether that's going for a walk around the block, trying something new, or some kind of dietary change, try it out. Just start there. Start small.
Excellent, Brian. Great advice.
Yeah.
Okay. Well, thank you so much, Brian, for being on the show. All right. Aloha, Brian.
Yeah. Aloha to everyone out there. And thanks, Angela, for having me as part of your podcast. I really appreciate it.
Welcome.
This is Angela Grayson from the Loving Life Fitness Podcast to help others in their fitness journey. All possible.
It's time to wake up. Here we go.